Kelleher. Hi, Mary.
Hi,
How you doing?
I'm good. How are you?
Good. So why don't we start? And then by the time we get through introductions and stuff, most people probably will have joined. So I just want to welcome everyone. You guys all know me. I'm Lynn Frano. I'm the Substance Use Prevention Coordinator from the town of Braintree, and really happy that you're all joining in tonight for our May meeting. Tonight is my oldest daughter's 32nd birthday. So after this, we're gonna have a little game of trivia with my family. So I'm really looking forward to that. So if you just want to announce, just introduce yourselves. We'll start up with Meredith. Introduce yourself, your name, your affiliation, and maybe something that you're looking forward to or something, anything like that.
All
So
right.
we'll start with you, Meredith.
Okay, I'm Meredith Berica. I am the lead stakeholder for the town council, so absolutely thrilled group and part of this community as a whole. And what I'm looking forward to. I know there's something. I am looking forward to some good porch weather. Our porch was under renovation last year, and it's been really nice to be out there. We had dinner out there with my family tonight. So that's been a real treat. So yeah, more porch time.
Very nice. Thank you, Meredith. Dave Morgan, how about you?
Dave Morgan, pharmacist, a friend of Lynn, and saw the agenda and looked like there was a few interesting things, so I'm here.
And everybody knows Dave used to work for the DA's office. He was on the coalition in Weymouth for a number of years, very active in the opioid epidemic. So thanks, Dave, for being with us. How about you, Sandra?
Hi, I'm Sandy Stamos, Braintree resident. We raised 3 daughters in the town. I've been very fortunate to be with one of my daughters and her husband, but I'm looking forward to brighter days for everybody.
Thank you. Sandy, you were saying earlier that she's in Florida. She's been stuck there, so someday we'll see you back here in Massachusetts, Sandy. Thank you.
That's right. Thank you.
How about you, Kristen Woodbury?
It is.
So I'm Kristen Woodbury. I'm the Chief Operating Officer at Aspire Health Alliance, and many people know us as South Shore Mental Health. We changed our name about 2 years ago.
Yep.
So I figure about 5 or 10 years I'll still be saying formally South Shore Mental Health. I've been employed here for about 15 years now in multiple positions, and in my current position for about 1.5 years or 2 years.
Great.
And I'm looking forward to homeschooling being done.
I'm sure you and lots of other folks. Thank you, Kristen. Mary Beth.
Mary Beth McGrath, Director of the Building and the Health Department. Am I supposed to tell you what I'm looking forward to now? So I'm totally looking forward to a massage, a manicure, and a pedicure.
That's awesome.
They're not open yet, though. Phase 2.
I was going to say, that's in phase 3 now.
Phase 2, phase 3.
Yeah. But just so people know, Mary Beth's been very, very busy as the health department director during COVID-19. And I would just want to recognize her for all the great work that she's been doing. Thank you, Mary Beth.
Thank you.
I'm proud to say she's my supervisor, and I love being part of her department.
Well, we feel the same way, Lynn.
Well, thank
How
you,
about
Mary Beth. All right, Christine Fosco, you're on.
Hi guys, Christine Fosco, I'm a parent. I assume we're introducing ourselves. I'm sorry, I stepped in late.
Yes, we're just introducing ourselves, our affiliation, and maybe something that you're looking forward to.
Oh boy. Lots I'm looking forward to. Christine Fosco, parent, lead stakeholder. Love being on the partnership. At some point in life, I'm looking forward to having these meetings in person again. Not that the Zoom isn't great, but I miss my personal connections.
We hear you, Christine. Thank you. Derek.
My name is Derek Top. I'm a lead stakeholder for parents, Braintree resident. I also work at a youth addiction program at Boston Medical Center. I'm the program manager there. What am I looking forward to? A lot of things that people said. The homeschooling thing needs to end. I'm ready for that. Also hearing, one of the loves of my life is basketball, and I'm hearing the NBA is starting to talk about coming back. So I'm looking forward to that.
Awesome. Thank you, Derek. And Andrew, I forgot to tell you, if you want to start recording, you can. Did you?
Yep, all set.
Oh, thank you so much. Leah.
Hello there. My name is Leah Hallett. I also work with Aspire Health Alliance with Kristen. I don't have 15 years to match Kristen's, but I'm going on year 7, I think now. As of September, I'm the director of integrated behavioral health over at South Shore Hospital, with overseeing a couple of our new and exciting programs. So lots to look forward to. Looking forward to kind of hearing more from everyone here, and also getting a hair appointment finally, and getting my roots done so I can pretend I'm a natural blonde again. Fingers crossed, not too much longer.
Thank you, Leah. How about you, Noel? Hello there.
How everybody doing? My name is Noel Sierra. I'm with Moore. I'm the Southeast Regional Coordinator. I'm actually looking forward to being able to visit the recovery centers and visit the programs and just kind of get back into being around individuals in recovery and just being around people, because I'm an extrovert. I love being around people, and being enclosed, being in my house is kind of driving me. If I had hair, I'd pull it out, but
Well, thank you, Noel.
To be able to hold my granddaughter for the first time too, I'm so looking forward to that. I'm a newly minted grandfather, and I haven't held my granddaughter yet, so I'm excited to be able to do that.
Congratulations. I know I haven't held my grandson. He's only 7 months old, and I haven't held him since March, early March. So I hear you, but it's even worse when you never got to hold him.
Yeah.
So
yeah.
that's great, Noel. Congratulations.
Thank
All right,
you.
Robin Houston Bean. Oh, you got to unmute yourself.
Yeah, I know. Sorry.
You know this.
Yeah. So I'm Robin from the Summer Rise Foundation, and I guess I'm looking forward to, here, can you see Stanley? He's made his way into the pool, so I'm waiting for him to actually get off his step and go swimming.
He's adorable. Thanks, Robin. Sue Penson.
So I'm Sue Penson, represent the faith community, and I'm looking forward to getting together with people again, like everybody else is, I think. And we've been on before COVID-19, we're actually on a waiting list for a puppy. And so we're now getting up the waiting list, so I can't wait until we get our new puppy, because our previous dog passed away, died just before Christmas.
Oh.
So yeah, so we're getting another miniature Dachshund. So yeah.
Oh, nice, nice.
So, yeah.
Thank you, Diana, the lovely Diana. You're on.
Hi, I'm Diana Clary. I'm house manager for Nikki's Place, Women's Soul Home in Braintree, and lead stakeholder. I am looking forward to being reunited with my Manny Petty girl. But I think before that happens, I'm going to get to meet my friend, just gave birth during this. So I'm going to get to meet the baby, not touch the baby. Meet the baby.
Meet the baby. Very nice. Thank you, Diana. Freddie.
Unmute. There we are. Freddie Viola, lieutenant with the fire department. I represent the fire department. Great to see everybody again. I wish we were in the room together, but this is kind of the sign of the way of the world right now. And also wanted to recognize Mary Beth, because I've been working, hand in hand, asking her a million questions, her and Jean McGinty and Mary. And unbelievable. It's been a great, they do a great job, and through all this nonsense, they've always been a steady ship, so it's good stuff.
Absolutely. Thank you, Freddie.
Oh, wait, and I'm looking forward to motorcycle weather. Thank God.
Now that hockey weather's over.
Well, no, the league starts on June 23rd. I can't wait.
Oh, goodness. You and my brother.
Yeah.
Thanks, Freddie. And we have Mary Kelleher.
Oh, okay. My camera just went off. I'm not really sure why, but I'm Mary Kelleher. I'm the youth representative, and I am most looking forward to learning in a classroom.
Awesome. Thank you, Mary. And actually, we have another Mary Cole.
Yes, hi. So I run the Greater Boston Tobacco Free Community Partnership Program out of Bay State. And I have a very short term looking forward to, which I just found out like right before this call, that my neighbor said I could use their pool on Friday and Saturday. So I'm very excited.
Very nice, Mary. Thank you for being with us. Kim Kroger.
Hi, I'm from Manic Community Health Center. I'm the Director of Prevention and Recovery Services there. I'm looking forward to doing something other than just going to work and being home on the weekends. So a little variety.
Yep. Thank you very much, Kim. John Griffin.
You, John Griffin, Braintree resident and parent, teenagers, and I am looking forward to when we can get the word go out to eat because the home cooked meals.
Thank you, John. All right, who's up? Andrew Marin.
Hi, everyone. Andrew Marin, lead stakeholder, and I work at Braintree Public Schools in the town of Braintree as a senior program manager for IT and systems development. And looking forward to getting my hair cut tomorrow. That's about it.
Yay! And we'll never know what his hair looks like because he never shares a picture.
I was just going to say that. Like, where's this picture? Come on, man.
Thank you, Andrew. How about Stormy? I don't know if Stormy can be with us yet. Maybe not. Okay. Brianna.
Hi, can you hear me?
Hi, Brianna.
Hi, I'm Brianna Keating. I work at Bay State Community Services. I'm the program director for the SAPC and the MOPC. So the SAPC does youth substance use prevention. It's regional.
You still with us, Brianna?
Yeah, can you not hear me?
Yeah, so you just said you did the SAP, you talked about SAPC?
Oh, sorry if you can't hear me. My internet is a little unstable where I am right now. But I also do the MOPC, which is overdose prevention, regional.
Great. And anything you're looking forward to, Brianna?
Oh, just hopefully some continued nice weather. I really want to get like a little, I have a 10-month-old son and I really want to get a sprinkler going or a little pool or something like that.
That'll be fun. Thanks, Brianna. Tristan Penson.
Hey, how you doing? I'm Tristan. I'm Sue's son. My reception isn't too good. I'm up in New Hampshire right now, so hopefully it'll last. But I'm new here. This is my first call. Excited to learn more about this. My mother has told me some really cool things. I just graduated from college, and I'm applying to jobs and medical school. So those are two big excitements for me right now. Super excited for the call, though.
Great. And thank you for joining us for the first time. It's awesome. Thank you. Anybody else I missed? I know Trish is here because Trish has taken minutes and she decided to do it this way. Right, Trish? Do you want to say hi? No? Okay. Andrew, should we check the chat box just in case? Mary Beth raised her hand.
Yep. Yeah, nothing in chat.
I have a question. I'd like to know why Leah has a blowing palm tree in her background. Where is she?
I ignored the travel advisory and I made my way down to Cancun. So here I am. My boss, Kristen, is too good to me. So
I need a boss like that.
I need all the brownie points I can get, you know.
That's one of those beautiful virtual backgrounds.
Nice background.
Well, it's either that or my bulldog in the background. So I figured the palm tree is a little bit calmer than her snarls.
That's awesome. Thank you. Oh, Steve Lear is with us. Steve, you want to introduce yourself?
Hi, everybody. Sorry I'm a little late here. I'm Steve Leary. I'm from the mayor's office in the town of Braintree. And Are we doing a fun fact, Lynn, or are we?
No fun facts today, but we are letting
Wow.
people know like what we do and also what you already said, but we're also talking about anything you want to share that you're looking forward to.
Sure. I'm looking forward to some better days ahead, and you know, hopefully you know, seeing some more people as we start to reopen a little bit, but you know, definitely keeping everything safe and doing it the right way, but definitely looking forward to some better days ahead.
Awesome. Thanks, Steve. And Steve's another one who's been working very hard in the mayor's office since the start of the pandemic. So thanks, Steve, for all you do.
Thank you, Lynn.
You're welcome. And I see you taking the lead from Andrew there. You must need a haircut too. No. All
Is
right.
that his excuse?
Today's excuse.
All right. I don't know if Kathy Wood made it back on. She was here, but then we lost her. Andrew, should we go to, is there anything we should learn about in chat?
Nope, nothing in chat.
Nothing
I don't
in
see
chat.
Kathy on here
Okay.
either.
All right. So I'm going to start the PowerPoint. So Andrew told me I have to go to share screen, correct?
Correct.
Is that what I did? Oh my God, I did it.
You click
And then I'm going to hit share on the right.
the left side.
The left side says share computer sound.
Yep.
Which I did. Now share. Okay, and I'm going to start. Thank you, Michael. I'm going to start the slideshow from the beginning. I think. Yep. Awesome. Okay, so welcome everyone. Thank you all for the lovely introductions. It's so good to see everyone. This is who's in the room. And the agenda tonight, we did our welcome and introductions, and I know Kristen and Lee are here from the Bridge program and Inspire, and I just wanted to start with them so they can get off and enjoy the rest of their evening. So they did send me some slides, so I'm going to start with their slides. And here we go. You girls are on.
All right. Well, thank you again for inviting us to come. Where we just have a few slides just to kind of guide the conversation. Any questions at all, feel free to, I guess, raise your hand. I would say, or speak up if we don't see you, if you have questions as we go along. Really kind of informal in the Zoom world. So
Kristen, before you start, I just wanted to say, I'm on the Department of Mental Health Area Board representing the town of Braintree, and that's where I met Kristen. She did a wonderful presentation, and I invited her to join us at some point. And so thank you for being here with us. It's been a few months since that time, but I really appreciate you being here. Thank you.
So just for anyone that doesn't know Aspire in general, so Aspire is, again, formerly Social Mental Health. We have programs that run from Boston all the way down to the Plymouth area, all the way down to Fall River, New Bedford. That includes DMH contracts. So we have residential services that are in the kind of the 10 towns of the South Shore. We have clinics, 2 in Quincy, 1 in Wareham, 1 in Plymouth, and 1 in Marshfield. We do outreach and child services in the home throughout the Plymouth, Quincy, Boston, Brockton areas. And we also have a program called Community Partners that works with mass health clients that have high needs, either medical, substance use, or mental health needs in the whole, basically Quincy to all the way to the Bridge, then I'll get all the way down to Fall River, New Bedford area. So we have a lot of different services, but just to give you kind of a little bit about who we are. And then today we're here to talk about what we have for substance use services, including those that we have at South Shore Hospital in partnership with them. So our Quincy clinic has 2 outpatient therapists that specialize in substance use therapy. So we had a BSAS license that is a Bureau of Substance Abuse Services to provide substance use therapy a few years ago, for many, many years, and then we let it lapse. And what we saw is that, why did we ever let it lapse? Because there is certainly a need for that. So a couple years ago, we went and got the license again, and we've been building back up our program since then. So currently we have 2 outpatient therapists that specialize in this. We have our Discovery Day Treatment Center, which is currently located in Quincy. It is actually moving to the building I'm in right now in Braintree. One of our new buildings is 1501 Washington Street, kind of near the Thayer practice grounds, right off of Washington Street. And that day treatment program is going to be moving to there probably in July. It's been a little bit delayed because of everything that's going on. And they have a dual diagnosis treatment track. So that is people that can come really any from 2 to 5 days a week. Length of stay in that program is anything from about a month to a couple years, depending on what people need. It is not a straight substance use treatment. It is a dual diagnosis, and we do have groups that focus on the dual diagnosis. So if someone is actively using, we would probably have them go to some sort of other day treatment program or newly sober, and then transition to that for kind of, additional support. Currently, we have no wait list. So I did put our phone numbers down for our intake as an available resource for those programs.
Excellent. So I can go on to the next screen?
Yeah.
Okay, cool. Thank you.
Our emergency service program is we work with people in the community. So we have 10 South Shore towns and cities. So Braintree is one of those. It's Quincy, Braintree, Weymouth, Randolph, Situate, Hingham, Hull, Cohasset, Norwell, and Milton are the 10 towns we service. And the 3 local emergency departments, South Shore, BID, Milton, and Quincy. And that is for anyone that's experiencing any acute or chronic behavioral health issue. So if someone is in the community and just needs some either support, because we like to, I think one of the misnomers, it's called an emergency service program. People think they have to be in acute crisis to access our services. But our thing is we want to get in as early as possible to help avoid that acute. So they can call us and we can do anything from having a quick phone call to give some resources to them to meeting in person and doing some sort of assessment evaluation that might result in anything from, let me help you get an appointment with a therapist to you might need to go inpatient and everything in between there. We are insurance blind with these. So if someone does not have insurance, we will still see them. And again, it's a great local community access to be able to find the support in the moment. We're 24/7. There's always a triage clinician and a master's level clinician available to talk to. Right now, during this crisis, we continue to see people. We're using a lot of telehealth right now, as is a lot of organizations. But we will see people in person if needed or through telehealth if that works.
And the number, the emergency service program, that's the contact number on the screen.
Yep, and that is a 24/7 number.
Yep, which is great. And I can send that information out to people. So Diana, if you wouldn't mind putting that on the action item list, that would be awesome. Okay, next screen. Let's see, jail diversion.
So jail diversion, we currently have 5 local towns and cities with a jail diversion clinician, and Braintree is one of them. Megan Scott is our jail diversion clinician in both Braintree and Milton. She's shared. We also have one that's shared with Hingham and Weymouth, and then we have one in Quincy. This is a DMH funded program to help support local police with any behavioral health issue in the community. I think that 2 big things of their job is, one, to be proactive. So if the police have had interactions with people that they're just kind of like, something's going on, I think they could use a little additional support, maybe some referrals, maybe someone to talk to for 5 minutes, just something that Megan and our other jail diversion clinicians will step in and do that proactive work to try to avoid the crisis. And then also reporting to crisis situations with the police to help de-escalate with the goal of diverting people to treatment rather than jail. And that person, Megan, can be contacted through the emergency service program or through the Braintree Police. And again, we do have all the other towns as well. This is one of our goals, is to have a clinician in Randolph. Randolph Police are right with us with that goal. DMH has supported our application. They just have no money to fund it. So we're waiting for that. because I think Randolph has a big need, and I think that helps a lot. And I know, and I talk about Randolph because it's a town that touches. So there's, stuff doesn't stop right at the border. So to have those jail clinicians really would be helpful. I actually would love to get 2 in Randolph because of the size.
Wow. Thank you. I'm going to move on to the next slide.
So I'm going to let Leah talk about the next couple slides. So this is about a year and a half ago, 2 years ago, we started talking to South Shore Health about a partnership, working with them on a substance use treatment and what that would be. And so we have developed and are chugging along pretty well with a program that Leah is going to talk about.
Thank you. Yeah, so we've it's been pretty exciting, kind of, overseeing some of the transitions that have happened within the health system over the past 8 months or so now. Back in September, Aspire moved in full-time to the emergency room in the hospital to do emergency services evaluations that Kristen just spoke about with our crisis and ESP team. And back on October 23rd, we officially opened in collaboration with South Shore Hospital the Bridge Clinic, actually 3 different substance use disorder treatment lines. The hospital has been very committed, along with Aspire, to really provide proactive and preventative treatment whenever we possibly can, and take a really harm reduction approach to meet patients where they are at any given time. So the hospitals, I personally, I think over my 7 years working with Aspire, I've seen a significant shift around just the culture around substance use disorders, which has been amazing to see firsthand. And I think in a big way, this happened, since September and October when we opened up. What they are now doing, along with standard vitals and other nursing protocols, is that they're screening all individuals who come through the emergency room, regardless of presentation, for unhealthy alcohol use and substance use disorder, which is amazing. And we do have a pretty low threshold, which is great. The idea is, let's identify early if there is an opportunity to engage in a discussion in the emergency room or on the medical floor. We want to do that, as soon as we possibly can, through motivational interviewing, again, a harm reduction model, and just offering supports. Education is key to all of this. We do have, we're modeled with evidence-based treatment to ensure that we're providing the best treatment possible for individuals who are looking to engage in treatment with us. And we want to make sure that we're following up, we're outreaching, we're staying engaged with patients, so that when an individual may be ready to talk with us or engage in treatment, that we're there and they know how to access us.
Great. Next slide, Leah.
Yes, please. So I just want to talk a little bit about the 3 different service lines that we have, that we work with South Shore Hospital on at the moment. So I just want to start off by saying all 3 of the service lines are multidisciplinary teams that consist of physician, psychiatric NP, 3 psych NPs actually, other nurse practitioners. We have RNs and also independently licensed social workers who are part of Aspire. And again, the goal is to really provide a wraparound approach and a holistic approach to the individual to provide the services he or she may want at any given time. So I spoke a little bit about the addiction consult service, but I'll start off with the Bridge Clinic just to follow along with the slides. The Bridge Clinic is an outpatient program that opened its doors back on October 23rd. It's a Monday through Friday program, 7:30 to about 4:30 in the afternoon. And right now we're taking same day, if not next day, or 48-hour appointments, which is amazing. The idea, similar to its name, is to bridge patients from the ED or from the point that they make that decision to reduce or even acknowledge unhealthy substance use for about 6 weeks prior to linking them up with further treatment. And that's really individualized. It is a medication first program. So we do, our addictions medicine director, Dr. Todd Kerensky, did his fellowship with BMC's Bridge Clinic. He's amazing. One of the most passionate individuals I think I've had the opportunity to work with, which Kristen can probably attest to as well, or anyone else who's had the opportunity to work with him. But we're really fortunate, and we're building up a team of a lot of providers right now that have quite a bit of experience in treating substance use disorders. So in regards to MAT medication right now, we are looking at most of the FDA-approved medications and able to prescribe naltrexone for opioid and alcohol use disorders, buprenorphine, and acamprosate. We do not initiate anyone on methadone. However, we have a very close relationship with some community partners, and we're able to get someone in almost immediately if that's the best, if the patient and the individual, the patient, any family involvement, and the provider feel like that's the best course of treatment. As part of the treatment plan, we always offer, but we do not require therapy. We want to make sure that everyone sits down with our LICSW social worker and has that conversation, really set up a treatment plan. What do these next 6 weeks look like? Really lay out that this is a harm reduction model. There are very few expectations that are required that would lead us to no longer be able to care for someone. And one of them is a medical necessity for sure. But the Bridge Clinic is pretty capable of managing, mild to moderate withdrawal symptoms, as long as, again, it's medically appropriate. We're currently located within the walls of the hospital as an outpatient clinic, but we are building up. The hospital has got a pretty great donation from the Graken family and looking to build a beautiful facility across the street and over at 797 Main Street, which is, we're very fortunate to be able to have a distinct area that's going to be outside of the hospital to reduce stigma, to allow people to come in a really safe space in order to have their find support, from our providers or another member of the team. But currently, like I said, we are located in the hospital until we do finish construction across the street. And again, that's Monday through Friday, 7:30 to 4:30, and pretty much able to meet with people within the next day or two if anyone's interested. And we also accept walk-ins as well. We always encourage people to call in advance. Our reception number is on the bottom, that contact number, but we can always accept walk-ins as well. The second program within our, any questions about the Bridge Clinic so far? So I see one, why would they not make therapy mandatory? So we take an evidence-based approach, and the evidence suggests that for the treatment that we are providing in the clinic, it is targeted at managing the medical symptoms of someone's disorder or use disorder, I should say, at any given time. We always encourage quite a bit of motivational interviewing to engage members in therapy. And I would say we haven't had anyone thus far that isn't willing to engage in therapy. But we don't want to eliminate someone from an opportunity to meet with a provider, to get that nursing support, to manage their withdrawals, simply because they may or may not be able to engage in therapy, because everyone's at a very different place within the recovery at any given point in time. A lot of times people also have outpatient therapists that they want to continue working with, or they may have recently completed a partial program, or may explore other holistic options for support outside of just traditional psychotherapy.
Any questions?
No? Okay.
Great question.
The perinatal behavioral health clinic is the second service line under the umbrella of South Shore Health System, which has been tremendous. We've been able, since October 23rd, we've had 823 consults with women. This program is targeting behavioral health symptoms for women preconception, during pregnancy, and up to 2 years postpartum. It again is a medication first program for psychiatric illness as well as substance use disorder. So we are kind of in the works of really refining what the program looks like, as we are in the process of applying and obtaining our BSAS license. In the meantime, we are certainly able to kind of engage and meet patients where they are at. We always encourage, whether it's a single parent, whether it's a family, to really engage in the treatment. And again, that's with therapy, nursing. We work very closely with our OB practitioners in the hospital, at South Shore Medical Centers. And also we work closely with DCF and say, this is what to anticipate. This is what this looks like. Let's prepare, how can we support you in anticipation of the birth of your child? Let's come up with a treatment plan. Let's, a plan of safe care to really help people, along that journey. And also preconception, like I mentioned, to help someone plan in advance. That's something that they're looking for. I'm sorry, I distracted. I see a question here.
Oh, I'm sorry. Yeah.
Will they work with recovery coaches? Yes.
Oh, good. Okay.
So I should mention the Bridge Clinic does have a recovery coach through Bay State. Haley, she's amazing. She works at the Bridge Clinic as well as within our inpatient service within the walls of the hospital, who's been great. And I think the perinatal clinic is also exploring, you know, bringing on one or two or multiple recovery coaches and peer specialists, not only for the substance use disorder patients, but also those presented with a mental illness as well.
That's great.
And again, that's a Monday through Friday program, 7:30 to 4:30. We have our midwife and psychiatric NP, Julie Paul, who oversees that program from South Shore Health, who's been a midwife for several years now. So it's pretty great to have the integration. I see someone else asking, do they offer walk-in drug tox screens? So we do, if someone's walking into the clinic, whether it's the perinatal clinic or the Bridge Clinic, part of the intake usually consists of a urine drug screen. So if it's someone looking to engage in treatment, absolutely. But if it's for an alternative, you know, if the request is coming in or if the person's seeking those results for a different provider, I don't believe off the top of my head that that's something that we're providing at the moment. But I don't want to speak for South Shore Hospital, particularly with their lab and their current policies. But as part of the intake's about an hour and a half, so it's pretty thorough. So the third service line, which I kind of touched upon within the emergency room setting, is the addiction consult service. This is you know, if you think about the perinatal and the bridge clinic and the perinatal clinic being outpatient clinics that will be moving across the street to its own building, the addiction consult service is in the walls of the hospital, in the emergency room as well as on the medical floors. And all those individuals who I mentioned earlier, who may screen positive for unhealthy alcohol or substance use, would be automatically populated to have a consult with one of our addiction consult clinicians who are with Aspire, which is 7 days a week covered, and or an addiction medicine provider. And our providers are able to initiate medications to manage withdrawals directly in the ED. They work really closely with our providers as well as our hospitalists on the medical floors to make sure that we're ensuring the safety and comfort of individuals while they're in the hospital. Once we're able to engage patients and make sure that they're not actively withdrawing in a way that's impeding their ability to engage in a discussion, you know, we are able to have our addiction consult clinicians through Aspire sit down and just have a conversation with someone to figure out where they're at, what they're looking for, if anything, what kind of supports they have in place, and it's utilizing the SBIRT model to really utilize motivational interviewing and, you know, see what the person is looking for. So if the person's in the emergency room, we typically have a single conversation with them. But if the person is on the medical floor and may have an extended stay, regardless of the reason, it could be for a surgery, it could be for an unrelated issue, we will continue to work with them during their time in the program. I mean, excuse me, in the hospital. Any questions?
So that's kind of a brief overview, just kind of an introductory of what we do for substance use services. We're really proud. Again, I think one of the things that Leah said is there used to be a real disconnect in the behavioral health world with, you know, mental health and substance use, and you did one or the other and never the twain shall meet. And I think that is changing. And I think we realized, you know, we have to change because this is the needs in the community. And I think South Shore Health really has done a great amount of work within. They had a whole thing of reducing stigma, the whole campaign, which I thought, you know, was great. And then partnering with us, which is a great choice, partnering with us to provide, again, not just the medical model of the treatment, but also the therapeutic model to be able to kind of look at it both ways.
Excellent. Was there another slide? I don't remember.
I think there was the 5.
The 5. Okay. I can't thank you enough, Kristen and Leah, for being with us. I was just wondering, do you guys have brochures? I know in the last newsletter that we sent out, I don't know if anyone opened it, but I did have a link to Dr. You just referred to him. Is it Chris?
Krinsky?
Oh, Dr. Krinsky, yep.
Yep.
Yeah. Just talking a little bit about the Bridge program. So it's great to check out the website there. But do you have brochures or anything that we can pick up and at some point and share? Because we have like a lot of resources out in the community, different places that we leave things.
Yeah, absolutely. I can talk to Janet Sullivan, who is in charge of all that, and I can ask her to get you some of that because I think that would be great.
That would be awesome. Thank
You
you.
have amazing programs, but if no one knows about it.
That's right. That's right. So that's why I'm so glad that you're here, and we'll do the best we can to promote it. Hopefully we'll add you to our website and to other kinds of things, social media and all that. So thank you so much for being here. Does anyone else have any questions before Kristen and Leah leave us?
There's one question about heart.
Oh, the heart.
Oh, yeah, I can answer that. So the question is, does Heart still work at a South Shore hospital, or has this service taken over their functions? No, I mean, what the services that I can say the clinicians and the providers are providing are vastly different than what a recovery coach can offer our patients, our mutual patients, I'll say. So the ESP team in particular, the crisis team, works very closely with Heart, as, you know, in the emergency room, as well as, you know, particularly in the ED, I should say. So we're in regular communication with our recovery coaches. Dr. Kernsky and I have met with Warren from Bay State and have, you know, attended some of their staff meetings as well to kind of build up our collaboration. You know, like I said, we're all providing different services, and we just want to provide every possible avenue to the patients that we're seeing come through the doors every day, and trying to reduce risk. And again, harm reduction is really our philosophy. So offering every patient every opportunity is kind of our goal.
Great. So it sounds like you're collaborating with the Heart program, which is excellent.
Yep.
Great. Any other questions?
I don't have a question, just a statement. Moore is in the process of actually revamping their resource guide, and I would love to be able to make sure that that goes into the resource guide. I think I just sent my email address to Kristen, but I just wanted to make it known. Love to have you guys in that resource guide. That resource guide, Mary, you know, we call that our resource Bible, and it goes, you know, every regional coordinator gets one of those, and that goes across the state of Massachusetts, so that everybody who's looking for resources, whether they're in Braintree or not, but if they come into this area, they know that they'll be able to turn to you guys at Aspire. You know, so I'd love to be able to have that information.
Yep, absolutely. I just wrote down your email address, so I'll get that to you.
Fantastic.
And feel free, if anyone has any questions for Kristen or I directly, you know, I can certainly be reached if you contact the bridge number at the bottom of the screen. You can always ask to speak with me directly or via email, whatever works best. Certainly for any questions, or if you have any, you know, anyone that you know might need our support, just please reach out anytime.
I'm typing in our email addresses just so people can have them if they want them.
It's very quick. She's getting good at Zoom over here.
I Zoom all day, every day.
All day, every day, right?
Well, thank you so much, and that was great, Noelle. I think that would be awesome for, you know, to have them in the Bible, so to speak, because Moore does have a really good, it's not even a pamphlet, it's a nice little book now, so resource guide. So thank you so much. I really appreciate you being with us, and I hope we see you soon. And again, if anyone has any questions, please feel free to contact the number on the screen. Again, it's Leah. Leah, say your last name again.
Hallett. H-S-L-L-E-T-T.
Yep, and Kristen Woodbury. So, and I believe, and I'll send out Diana for the action. I'll send out their contact information and numbers and all that. So thank you, ladies.
Thank you very much for having us. And again, feel free to reach out anytime for questions or anything.
Awesome. Thank you so much.
Great.
That's
Thank
great
you.
news. Great information.
Yeah.
Thank you.
Thank you.
Have a great evening.
Thank you.
Thank you. All right. Let's see. So thank you, Kristen and Leah.
Thank you.
Lynn, just wanted to know, Kathy and Marianne joined too during that.
Oh, Marianne.
Hello.
Hi, Marianne.
Hello. Hi, Kathy. Hey, everybody.
So good for you to join us. All right, so I'm gonna go. We have a lot to cover tonight, so I want to keep going. If anyone, if that's okay. Want to talk a little bit about tobacco. So I've invited Mary Cole to talk about tobacco. So I'm gonna bring up her slides, and I'm gonna let you take over.
Ooh.
Mary Cole.
Sure. Thanks, Lynn. And let's see if you can read my mind when I want to go to the next slide.
Yes, I saw this.
So, sure. So I do tobacco prevention work. I work at Bay State Community Services, as I mentioned. And so now it's just kind of really important to think about tobacco and vaping, along with coronavirus, COVID-19 as well. Also to note, in the substance use world, like tobacco and nicotine is a substance. And it's also used with other substances. Many people in recovery, they do smoke or they do vape. So it's just something important to keep in mind as I talk about this stuff. But from Dr. Nora Valkow, she said this quote, because it attacks the lungs, the coronavirus that causes COVID-19 could be especially serious threat to those who smoke tobacco or marijuana or who vape. So you guys know, as I go through these slides, I'm not going to talk about marijuana because my job is funded to talk about tobacco and vaping. So I just don't have many resources on marijuana.
All righty, and that's my cue to move on.
Yeah.
To the next slide.
Sure, so I'm just going to briefly go over some of the risk categories for smoking, vaping, COVID-19. Just as some background, we have conclusive evidence on how terrible smoking is for you. So with some of these statements, it's a lot more conclusive with smoking. With vaping, it's just more suggestive because we don't have a lot of research on vaping yet. There's just like a few studies that are out there. So just to keep that in mind. So we know that if you smoke or vape, you're at higher risk of more complications from COVID-19. We also know that smoking and vaping can make the infections worse. And these cases can be more severe. We know, for example, that flavored products can make lung infections worse. So things like COVID-19 worse. Thank you, Lynn. We also know that smoking is really bad for your lungs, and so is vaping, as we see evidence emerging. And so that they can damage the lungs. And we know that COVID-19 attacks the lungs in many cases as well. And then the other note is that smoking and vaping can also weaken the body's immune system to fight off infections like COVID-19. And then finally, just the note of if you smoke or vape, you have a lot of hand to mouth contact. That now, like don't touch your face. And also just the like social sharing of a lot of people can share it, which just could make this more spread it easier. And then just so if people do know any smokers or vapors or work with any smokers or have clients that are smokers or vapors, if you have that conversation with someone, first to acknowledge that it's a really stressful time, that people might be relapsing, people might be smoking or vaping more, but also to say that they do deserve to know that they are at higher risk of complications from COVID-19. And to also clearly state that there is resources to help them. So there's the helpline, you can talk to your doctor, and there's just all these free resources that I actually have on the next slide. I'm trying to go quick, Lynn.
Yes, nice job, Mary Cole.
So there's always the helpline, it's 1-800-QUIT-NOW, it's totally free. We really highly recommend that people call this. There's also texting on this as well. And you can also get free nicotine replacement therapy by calling and talking to someone. The new note that this is new in Massachusetts, insurance now has to cover a medicine, so nicotine replacement therapy. So there's like the gum, there's the patch, there's nasal spray. So it has to cover at least one, in each of those categories, it has to cover at least one brand. So if you get a prescription from your doctor, then that's covered. If you don't get a prescription from your doctor and you just go to the pharmacy to pick it up, that would be out of pocket cost.
And Mary, what about people under the age of 21?
Yeah, so if you're 18 years old or older, you can just get a prescription from your doctor for this and just all of the supplies. If you're under the age of 18, it's a lot tougher to get a prescription from your doctor. It's still pretty new for young people to be using nicotine replacement therapy, but we're starting to see it more with youth that vape because there's so much nicotine in vapes. So definitely to talk to your doctor or even specialists that are treating nicotine addiction with young people. They're starting to prescribe for those kids that are really addicted.
Excellent, thank you. Gonna move on to the next slide.
Yeah, so that brings me into the new law. So that little second bullet, the kind of talks about what I just said. The new tobacco law that was signed into law in November by Governor Baker. It does a lot of things. One is, I said, that insurance, if the insurance covers quit smoking medication. That starts June 1st. The other thing that starts June 1st is a 75% excise tax on e-cigarettes. There was only a sales tax before. And then the other thing that starts June 1st is increased fines to retailers who violate the law, to $1,000 for first offense, $2,000 for second offense, and $5,000 for third offense. And then back in December, they kind of said all vapes that have these higher nicotine concentrations can't be sold in gas stations and convenience stores. They have to be sold at adult only stores like vape shops.
Yep.
And then there's another piece of the law, if you want to go to the next, Lynn, which is the big one, which is kind of why Lynn wanted me to talk. Oh, did it not move? Isn't this the one that's supposed to move?
Well, this is where I put the video on.
Okay. Yes, I want to show the video then.
All right,
Yes.
so Andrew's gonna walk me through this. Andrew, what do I do? Because I have to get to the video.
Press escape,
Press escape. Okay.
and you go into the internet.
I'm going to the internet, and I'm gonna go to the no menthol thing right here.
Look at that.
And people can see it. Yay! I'm gonna play this video for everyone. It's short.
Imagine a just society where people are seen as more valuable than company profits. For decades, the tobacco and vaping companies have intentionally and continuously risked our health for their profit. They flavor menthol cigarettes to make them easier to start and harder to quit. They make menthol products cheaper in neighborhoods of color to get people hooked. They put more menthol ads and displays in Black and Latinx communities. And they target LGBTQ+ communities through ads with phrases like, "Take pride in your flavor." Massachusetts wants everyone to have a fair chance to thrive and be healthy. So starting June 1st, menthol and other flavored tobacco products will no longer be sold in Massachusetts stores, which will improve health in our communities. No menthol, no why. Visit nomentholnowhy.org for more information and tips to help quit tobacco for good.
Okay, so now I go back to the PowerPoint, right?
Yep.
Imagine a just society where people are seen as more valuable than company profits.
Yeah.
For decades, the tobacco and vaping companies have intentionally and continuously.
Cool. All right. I'm gonna go back to the PowerPoint.
Good job.
This slide here. Well, I gotta start from current slide. Ah, look at that. Woo!
Yay! Yeah, so as part of the new law, it basically says no flavored tobacco can be sold starting June 1st. This already applied to vape products. And the big thing is menthol cigarettes can no longer be sold in retail stores in Massachusetts. We really don't think that anyone knows that this is happening because I think it kind of got brushed over. But it is a really big deal that this is happening. Like that video mentioned, the tobacco industry has targeted communities of color communities like the LGBTQ community. They've targeted youth as well. So it is a really good thing that we're not going to have these menthol products on the market anymore that target these communities. And we also heard from that video that menthol itself makes it easier to start smoking and harder to quit. So that's like the mentholated like flavor to it. And then so just with this slide that I have here, if you guys want more information about that specifically of the tobacco industry targeting the Black community specifically, there's a documentary called Black Lives, Black Lungs that's 15 minutes. And it just goes into more detail, and I highly recommend it. It's, as I didn't know half, like any of it. So I highly recommend it.
This quote, I used to use this a lot. I've used it a lot for over the years. That says a lot. That was the guys from R.J. Reynolds. I think he was the CEO or something at the time. So just unbelievable. So I think what we're going to try to do is get a lot of this stuff out on social media so people are aware of it. Let's see what next, Mary Cole.
Yeah, I don't know what you put.
I know. I don't either.
I just sent Lynn a bunch of slides and told her to take what she wants from it. So I didn't really know what was coming. So that video that you saw was from this very brand new campaign that launched like last week called No Menthol, No Why, to educate about why the law is happening, because we think there's going to be a lot of pushback. I already saw some comments that are like, I'm going to go to New Hampshire, and I see the comments coming in about people stockpiling as well. So it's just meant to educate a little bit more of why it's happening, and also hoping to get people to quit and to promote quitting as well. So if you go, I think Lynn probably can share the No Menthol, No Why campaign more too, but it has that video, it has a lot of other social media aspects that if people want to share from their organizations or with people, I really highly recommend it. Also, you can partner with me if you want any of my assistance as well. And then the quit information, I always have like so much information on quitting in like newsletter form and shorter form. So I'm happy to share that with anyone as well. I always talk about the 84 movement with Lynn, and one day Braintree is going to start the youth prevention, tobacco prevention, and they have a lot of mini grants, and they're doing work on the new law as well. So I know there's Mary here that's the youth person. So one day you guys will do this.
That's right. Right, Mary?
Yes. And then I'm not going to really talk about this, but there is a faith-based initiative called No Menthol Sunday, where faith leaders they have their people not smoke on Sundays and kind of start that quit process. And I also am happy to do any more further presentations, whether it's the Black Lives, Black Lungs documentary or just something similar to what I did today, and other information too.
And Mary, I just wanted to talk about the No Menthol Sunday. I know we have we have at least 3 people who come to our meetings or present. I know Sue is here tonight. John Wilson, by the way, did send me an email. He's doing something with his folks on Wednesday nights. So he's not going to be with us for a little while during COVID-19. But if there's anything, if we want to get together with a group, we can do that. At least I know that we have at least 3 faith leaders in our in Braintree that might be interested in that. So if you could put that, Diana, on the action items, that I will reach out to the faith leaders, and if they're interested in learning more about No Menthol Sundays with Mary, we can set something up. Awesome. And let me see if there's another slide, Mary Cole.
I think this is it.
Oh, Mary Cole.
I have a question, Mary. Mary, could you send that to me in the email? That slide that you just showed? Is that something that you can send in an email?
Yeah. Yeah, Lynn, can you share Noel's contact info?
Yes. So this is the one, Noel, that you wanted to, this one that's up on the screen now?
All the ones that she just did on vaping and smoking and all that, yeah.
Absolutely.
Yeah, because
So
I do a
put that on the
vaping
action item
cessation.
list.
Yeah.
I do a vaping cessation. I would love to be able to have some of that information so I could chew it over some more and be able to spit it out appropriately.
Awesome. Yeah, and I have other vape resources as well for cessation that I did not include on here, I realized, but.
Awesome. I think I put my email in the chat. If you want to just grab it, and then you can shoot me an email. Thank you
Yeah,
so
and I
much.
also
Sorry.
have Mary, I have all of Mary's slides she sent me, and I can send that out to everyone so everyone has it. But that we'll make sure you get it. I will. That's on the action item list, Diana. Thank you.
Yeah, and the other thing actually too is thinking of, I know a lot of people in the recovery community that they specifically smoke menthols as well, that I've heard that. So
Well, that's one of the things that I'm trying to push, is to have programs recognize that the more individuals quit smoking, they increase their chances of maintaining their recovery. So that's one of the things that we're trying to make people, aware of as well, or individuals in recovery as well.
Thank you, Noelle. Thank you, Mary. Thank you, girl. And if you, I know you had a long day too, so you're welcome to say goodbye to us if you'd like. You're welcome to stay as well. But thank you again, Mary. You've been a great partner with us, so thank you.
Yes, thanks, Lynn.
Thank you. Bye.
Bye, Mary. Bye, Mary.
All right, next slide. So I'm gonna have Andrew and I talk a little bit about this, and I think if Stormy, are you still with us?
I'm still here.
Okay, cool. So the last time we met, we talked about the parent survey, and we had a nice little plan, and we had the Educational Development Center look over the survey and give us some suggestions, and even Meredith gave us some suggestions, and so it was kind of all ready to go. And Andrew talked with Dr. Hackett and Jim Lee, and these are some of the suggestions. Andrew, do you want to talk a little bit about this?
Yeah, sure. I think Dr. Hackett and Jim, they're all for the survey. That it was well structured and the questions look great. But I thought the timing was a little tough. On the district side, they've gotten a lot of feedback about this kind of that work-life balance on the parent side, and managing remote learning for students and their work. And I think a survey like this might be more effective in the fall. And also some of the questions were more, even though it asks you kind of reflect back to the winter, it's kind of, the questions were kind of timely, and that might be better in the fall when families are more active. So that's kind of their feedback.
Okay, and I'm gonna thank you. Does anyone have any questions for Andrew about this? Well, the next slide is something that Stormy put together, and I just put the actual numbers in, Stormy, into this slide. So in terms of translation, let's talk about that, Stormy.
Yeah, so for just, I think Dr. Hackett emphasized, or he also mentioned that maybe doing some translation of the survey so we can have a broader reach, or reach other, other parents in the communities where English may not be their dominant or primary language. So here are the 5 top languages in among Braintree students from grades 6 to 12. Out of 3,200 students in total. So for Arabic, about 1% speak the language. That's about 29 students. Simplified Chinese, or Chinese in general, that's about 5% of the student population. Portuguese, Lynn and I kind of talked about Portuguese. We're assuming it's Brazilian Portuguese. That's 1%. Spanish, 1%, and Vietnamese would be 3%. So these are the top 5 languages and their breakdowns. And after going into Qualtrics and kind of looking to see if there are Sorry. There are other, like if there are ways to translate it inside Qualtrics, and I looked into that, and they do offer translation. They have a tool that does it via Google Translate, and they translate all the questionnaires, the choices, etc. But the only thing that we really need is we need native speakers, volunteers to help proofread and verify that translation to make sure it makes sense. You know, Google Translate isn't, it's great and it's good for like one word or some things like that, but may not be culturally sensitive, or it may not make sense to have it translated in this way, or there's other words to use. So it's a great tool, but it would be better if we had some native speakers to help volunteer proofreading and verifying that translation. So if you know anyone that can speak Arabic or Chinese, Portuguese, Spanish, or Vietnamese, not only speak it, but mainly read it and be able to understand it, that'd be great. I personally can think of some for each of those categories, but it would be great if there could be other volunteers, even double check, and just one person checking may not be enough. But so yeah.
And reaching out maybe to I think even if we contact the China, they might be able to help us, to China 20 Community Health Networks Alliance, they may be able to help us.
When I did in the school side, we use services like certified translations, so I can help you with that too if we want to do that. And then it's fairly simple just to copy and paste those into whatever format we need.
Great.
And Lynn and Stormy.
Can you give me that one again? What was the action item?
Andrew has, the school department can use certified translation, so he's going to send some information about that. And if anyone has any, Meredith, just one sec. So if anyone has anyone that they know of that can help, either, just to prove some of that information, and we can contact some of our partners as well. But if anyone knows anyone or knows an agency that might be able to help us, that would be awesome. Meredith, you're up.
Sorry. Yep. So Quincy Asian Resources.
Yep.
They do translation, and it's usually free, I think.
Yeah, they've done a presentation in Braintree before with the China, so I think that would be a great resource, actually.
Yeah.
Thank you, Meredith.
I mean, one reason why I personally prefer native speakers and volunteers is to actually get them to participate or involved with the partnership. We can multiple, levels of proofreading, but it's one way to get them involved. And personally, it's a way to diversify our partnership to get them involved, because I think Lynn and I talked about being more intentional about that throughout our coalition capacity building and reaching out that people of color and people of different cultures is a little bit quite missing in the partnership. So it's a way to get them engaged in a way with the partnership.
Absolutely, Stormy. Thank you. So I'm just curious how. We can take more questions, but I'm just curious about how people feel about waiting until the fall, or waiting until, to get the survey out. And the other thing that Dr. Hackett really strongly recommended was using, getting it out to parents in grades 6 to 12 via email, rather than through Facebook and other types of social media. So he would target those families of students in grades 6 to 12, and then follow up at least a couple of times to see how things are going. And maybe we can throw something out in social media, just saying, maybe not with a link, but hey, did you see this, and link it to the school's website or something like that. I mean, there are ways that we can help to promote it as well. So I'm just wondering how people feel about that, rather than moving on now, getting it going now.
I think it's better in the fall.
Christine has her hands up.
Christine Fosco has her hand up. Hi, Christine.
Lynn. I have a feeling about that from a parent perspective, but also from a partnership perspective. I think that from the partnership perspective, I would have rather to see it done closer to the student survey. But from a parent perspective, anything that's optional is low on the list for me personally. And it's something that I would rather see people spend time on and really think about rather than just either ignore it or fly through it.
Agreed. Thank you, Christine. And I was also hoping that, maybe when we're doing some type of presentation before, the school committee about the results of at least the survey that was done, the youth health survey that was done in grades 9 through 12, that we can talk about it then. And I know that you're on the town-wide leadership team or whatever for parents, and it might be a good way to get it out. And we'll also be doing the grades 6 through 8 in the fall. So hopefully, so that might be a good time to do both. So thank you for that. Anybody else have anything they'd like to say? And that is?
Meredith has her hand up too.
That's Mary Ann.
Oh, yeah, that was me. Can you hear me?
We can hear you.
Oh, okay. I totally agree with what Christine was saying too, from a parent perspective, just because I kind of go across and look at all the different things that we're getting. And there's so much stuff that I think they will not focus as much on it now. And in the fall, I think hopefully, God willing, everything will be, back into some kind of normalcy, and they'll be able to focus more on something. Because from what I'm hearing, and I've been doing a lot of meetings with people in recovery that are not doing well, it's like overwhelming already with kids and everything. That's just my opinion. So
Thank you, Mary Ann. Thank you for sharing that. And Meredith had her hand raised.
I just was going to echo Christine's and Mary Ann's sentiments. So, yeah.
Awesome.
Okay, so we will work closely with Andrew and Dr. Hackett and Jim Lee, and be very thoughtful about it for sometime in the fall. Someone else has their hand raised. Who else said? 2 participants raised their hand. Any?
Noel.
Again, Lynn.
Christine again? Okay, we'll take Christine and then Noel. Christine?
Stormy, how soon do you need the parent survey translated?
Let's see. I mean, with Qualtrics, it's honestly a click of a button and I can get it translated. And then I can send it out to whoever wants to proofread it, and they can vet through it. Definitely, there's no rush since we're planning this for the fall. But Lynn and I personally feel it might want to look at it again, because administering it in the fall, we may ask a little bit more questions, just on the situation that parents have gone throughout, this spring and summer. But I think maybe anytime before finalizing it before like mid-August would probably be like the best timeline for us.
Yeah, I would think that would be, and at least then we'll have some time. Yeah, so are you thinking that you might have some resources for us, Christine?
One of my best friends is from Brazil. So she speaks English and Portuguese fluently, and she's awesome. So I'm sure if I asked her, she'd help.
That's great.
Great, that'd be awesome. Yeah.
So, yeah, I'll reach out to her. Sure.
Thank you. So that's Diana. That's just to put on the list that Christine Fosco will speak with her friend about being a proof for the Portuguese translation.
And Lynn, I have connections in Braintree's. I can reach out to my connections in Braintree's Chinese speaking community. So I put that on my to-do list. So I'll get back to you on that.
Excellent. So that's another action item, Diana. Thank you. And thank you, Meredith. Thank you, Christine. Does anyone else have anything they want to talk about? have any questions about, or Stormy, do you have anything else you'd want to share?
Noel has a question.
Noel has a question. Oh, that's right. I'm sorry, Noel. I knew that. Go ahead.
That's all right. I just, being a person of Latino descent, me being a person who's Spanish, and has seen how my parents handled paperwork or questionnaires or surveys from school. We need to be mindful to be able to give them enough time to go through it, answer the questions, comfortably. And, and in the fall, as you know, the schools send home a lot of paperwork, a lot of documentation, sign here, make sure this is, give permission for that. So we got to be mindful of not dropping too much on parents at the same time that the school's dropping stuff on them. You know what I mean? So if we're talking about doing this in the fall, you just got to keep in mind that in the fall, the kids are going back to school if, we go back to school because of this, but in the fall, so when the kids go back to school, they're coming home with all this paperwork for the parents to sign. Then the parents are going to get an email on top of that for a survey. So we just got to be mindful of, if you're going to drop this on parents, you got to make sure you give them time enough to fill this out so that you can get a good idea of, whatever the information you're trying to get from them. Because they are going to be inundated with paperwork from school. They are going to get inundated with permission slips, questionnaires, emergency documentation, all that stuff that your parents, get.
Remember those days.
So just be mindful of that.
Thank you, Noel. And that's really one of the main reasons why we're gonna work very closely with Andrew and Dr. Hackett, because they know they know that stuff, and I know that they will steer us in the right direction in terms of what to administer. So thank you so much, Noel. Points well taken.
Meredith, you just commented saying consider sending a mobile link to parents to complete on their phone. Do you mean sending it directly to their phones, or sending, like, having a URL?
I was thinking if you can send out a text link from the schools and have it be sent to your phone, then that eliminates another barrier of entry, like having to click an email, like of the set, like Noel was saying, of the 17 that are coming through. It is hard to keep track.
Yeah.
So just another idea to try to broaden participation.
Thank you. That's a good point, Meredith. And Andrew, I'm hoping that for an action item for you, that maybe you could talk a little bit with Dr. Hackett about the possibility of that. And I know you can probably talk a little bit about it now. Do you have any comments you'd like to make?
Yeah, so it's part of my duties in the team I have. So we consolidate efforts on the communications and try to limit it to kind of weekly instead of daily notifications. And we're making some upgrades for this fall in terms of how we disseminate information, and it's a little better. I think time-wise, if it was more late September, early October, it'd probably be good. So.
Yeah.
Yeah. Another thing that, Marian, were you speaking?
No.
Okay. Another thing that I personally had a strong feeling about was that Dr. Hackett only wanted to send it out through the Braintree Public School System emails, but that really takes a chunk of, students who go to private school. We have one or two or private schools in the area. So, and their values and their beliefs, parents of those individuals have values and beliefs that are also important because they're still part of our community. So that's also something to consider and think about too.
I can add just one more thing too. So in addition to translating the survey, we'd want to translate the message that goes out as well, because we can deliver it in these top 5 languages. So for families that have chosen that as their language of preference, so whatever that language, the messages that you want to go out in the email, it'd be good to translate it to this as well.
Sounds good.
Thank you, Andrew. Stormy, I hear what you're saying. So that's something that we can continue to talk with Dr. Hackett about.
Yeah.
And Andrew, if you just want to run that by him too. Stormy's points, that would be really helpful. Thank you.
Okay.
Okay. Anyone else have any questions regarding the parent survey? Okay, we're gonna move on, if that's okay. Thank you very much, Stormy, for that.
No problem.
Thank you, Andrew. I really appreciate it. Okay, we're gonna move on to the next, which is strategic planning. I'm gonna just go over this really quickly. Last week, on the 20th of May, we held a strategic planning meeting with our TA providers at EDC, steering committee members, and a couple of members that were interested in strategic planning in some of our partners joined us. We looked at available data and prioritized our community risk and protective factors. And the next meeting, we're going to be probably looking at and choosing evidence-based strategies. So I'm going to doodle poll. That's something that you can add to the list, Diana, is that I will doodle poll the same group of people about when we're going to actually, sometimes we're going to meet again. To finish up the process. And I don't know if anybody, if Christine or Derek or anyone wants to add a little bit, talk a little bit about the process. You don't have to, but if you care to share, anyone that was in the meeting that we held, it was a 2-hour meeting, and I can't thank you enough for the time that you spent. And Diana Cleary spent 2 hours on her day off with us. So if anyone else has anything to say, please chime in or raise your hand or whatever. Stormy too, if he was a part of it. Okay.
Oh, sorry, Lynn, it took me a minute to unmute. I'll just say quickly that I thought it was really valuable. The data, seeing it firsthand like that was fantastic. And Stormy, I know, did a great job running our group. We got to really delve into the issue and really think about like the risk and protective factors and talk about them in small groups. And it was really good. So for anybody who might be interested in the future, it really, I thought, was very productive.
Thank you, Christine. I appreciate that. A lot of time and effort went into that. Stormy, on her part, did a lot of the, did a lot of crosstabs and provided us with all that data from, at least from the survey that took place with students in grades 9 through 12, the high school. So, and EDC broke us up into small groups, and it was actually a great, it was a great meeting. So I want to thank all of you who joined us for that meeting, and I will be sending out a doodle poll. Does anyone else have any questions or want to comment on the strategic planning process? Okay, with that, we'll move on. Okay, so Kim Kroger is with us. I know Kim started work at 7 a.m. this morning. And thank you so much for being with us, Kim. And we were in a meeting last week with, I believe it was the MOPSI meeting, and Kim had some really interesting points that I thought would be great for people to hear during COVID-19 around opioid overdose, what they're seeing with outreach, MAT, medication assisted treatment updates, all that kind of stuff, current trends. So take it away, Kim.
All right, thanks, Lynn. Lynn asked me to talk about sort of what we've been doing since COVID hit. Our outreach team has been really busy. We've been increasing our outreach. I think I talked a little bit about that last month. But some of the things that we're really seeing in the populations that we're seeing, of course, there's more homelessness in the general population, but also in the substance using population. And with the shelters depopulating, they're not taking new intakes. We're seeing that on the rise. We're seeing more with all the pre-release. The prisons all did sort of a mass pre-release for a lot of people. And they did the best they can, trying to connect people with services and treatment. But as we're finding, people aren't going to detoxes as much. They're very afraid. where they're just not wanting to get the treatment, although we have seen some increase in treatment with medication-assisted treatment, which I can speak to kind of some of the changes with COVID that's experienced. I'm going to kind of fly through what we're seeing, and then I'd love to, if people have questions and want me to expand on anything, because I can talk about this for hours. But we, and I know everyone, it's almost 8 o'clock. So, but what we're seeing really with the homeless, people aren't wanting to go to detoxes. They're not wanting to go in to medical care even. They just are trying to isolate, trying to get information, and it's the agencies they're used to relying on for just their basic needs, like clothing and toiletries and just housing.
Hello?
Are you still there?
Hello?
Kim?
Did we just
Well,
lose Kim?
We got a situation.
We got a situation.
Andrew.
When's the internet?
Oh.
Yeah, connected.
I mean, is she there? No.
I think we lost her. I want to text her.
Can I just say something quick? What she was talking, when she was talking, I've seen, like, just from talking to people in recovery and stuff and being in recovery, so many people suicide, like thinking about suicide. That's overwhelming, like really overwhelming. I've never been through, like, friends of mine that I've had to go over and try to get to places because just being isolated, it's really, really, it's tough. It's the hardest thing I've ever gone through, really. It's crazy. But
yeah, it's not good out there. I just got an Kim just texted me to say her computer shut down for updates. So she's gonna try to log on by her phone, and sorry. And to save us time. Kim, are you there yet? All right, to save us time, we'll go on a little bit. I just wanted people to know that the June 17th meeting, we're gonna have you there, Kim? No,
she's
okay.
not.
Okay, thank you, Andrew. You let us know. Thank you. Val Walker, she's an author. She wrote 400 Friends and No One to Call. I believe I sent the information out to people. She's going to be doing a webinar for us on June 17th. Brave New Friendships, Building Support and Community Even While Social Distancing. So I did schedule her on the same time as our next meeting, and maybe we can do like a smaller meeting just to talk about the calendar for the rest of the year. But anyways, Val will be coming, and I'm just hoping people could email me or call me or text me or whatever and tell me ways that I want to learn more about ways that we can get this information out to people about this, because I think it's going to be a really good talk. And Robin Houston Bean is part of the book. She's mentioned in the book, in her book, and I just think it would be a really great. It'd be really great considering the time. Does anyone have? So if anyone could please let me know, just because it's getting late. Please let me know what we can do to get this out into the community, because it's getting close. June 17th will be here before you know it. So any ideas, any groups that you're involved with, we'll certainly get it out on Facebook and other places. But anything else, please feel free to let me know. I do want to show everyone a little, if this is okay with you, Robin. I want to share a video. So I'm going to escape.
I hope it's okay. Sorry.
And I'm going to go back to this, and I'm going to play this recording. It's something that the MAPC put together. And Robin, I'll let you talk. Robin, would you like to talk a little bit about this video and how it came about?
Yeah, so it kind of goes around the circle.
So I was involved with the Opioid Project, which is an art and I can't even think of the words. You get to talk and write about the person you lost. And first they did it with just people who had lost someone due to substance use, and then they ventured out and to do first responders and other people on the front lines. And they put me in touch with MAPC because the state wanted to do something to talk about substance use disorder and how it can happen to anybody. So they came out and taped us for a day, myself and my daughter Olivia, and just asked us our story. They put this together and they wanted to add some prevention information in it. So they tied in nicely with Lynn, talking to Lynn at the town hall about substance use disorder, you know, how it becomes an issue and what we can do about it. And they wanted to highlight the grief support that's available to people in the state. So I think in this short 6 minutes, they did a really great job at it. I mean, they cut down a ton because we had, you know, 10 hours of film.
There, wasn't it?
But they did a really, really nice job. So it's available to be shared anywhere. If you have any groups that want to see it, feel free to. You don't have to ask permission to. It's on the MAPC site. It's on my page. And we can send you the link if you want.
I got the link. Yeah, and we can maybe, you know, I know we're going to probably, Robin and I have a call on Friday morning with Val to talk about how we're going to structure the actual webinar, and we're also going to share this video. So does anyone mind about, do you want me to share the video now, or do you want to wait until, I mean, we don't have to share it now, and because I know it's getting late, but if you'd like to see it, who wants to see the video? Raise their hand, doesn't matter.
I shared it.
Kim's on now too.
Okay, here we go. I can make it, I can,
Awesome.
I started to get ready for my day, and so I yelled up, "Nick," and he didn't answer, and was go out the door, and something stopped me and said, "You know what, go just check upstairs on him." And I saw Nick on the bed. I could tell right away something was wrong.
I think I just kept saying Nick's dead. He's really, really intelligent.
He took the SATs in 6th grade, tested into the Johns Hopkins Talented Youth Program. We had fights over homework, sitting at the dining room table, like, please do your work.
Yeah.
Don't get in trouble at school, you know?
I feel like it was almost like it was boring for him.
He started smoking pot in high school, and then it went on to trading other drugs with kids in school. At some point, his senior year, he took an opioid.
In the early 2000s, there was a lot of OxyContin available. It was promoted that it was a safe drug.
So I sent him to college with an opioid addiction, but I had no idea. He didn't know anybody had the pills and went into a bad withdrawal, and someone introduced him to powdered heroin.
It's a developmental disease that happens early on from early use. Kids' brains are very different than the adult brain, and they're easily hijacked by some of these drugs. If your body craves it, you need to have it. You feel what they call dope sick. If you're not using, you really feel pain all over your body. It's not, you're not using it any longer to get high. You're using it to just feel a sense of normalcy.
So we were just kind of spinning our wheels with a kid who looked kind of sick, is acting kind of weird, and what's going on. And it never would have thought that I had a kid addicted to opioids. It's the last thing in my mind. My name is Robin. I lost my 20-year-old son, Nick, almost 5 years ago to a fentanyl, cocaine, heroin overdose.
I lost my son, Bryant. He was 25. I lost my son, Brian.
I lost my brother Nick, who was 20, to an overdose. I really hate when people say, everything happens for a reason. I'm like, there's absolutely no reason that my 20-year-old brother should be dead right now.
It was early on after we had lost Nick, and I was trying to do everything that I could to help myself heal, my family heal. And I thought, wow, Olivia's into art. This would be a great thing to do together. So the Opioid Project brings people together so that they're not alone, that they can express their grief. So it gives all sorts of people who have been affected by the opioid epidemic a voice. Then it gives the community at large a chance to talk about it and see it. I wish I knew what was going on, but I was blind to it. I guess I didn't know what to look for. I didn't know the behaviors.
I have a hard time admitting that my own son is a drug addict because I have the stigma.
We were all in denial of our kids when we didn't see the signs.
Stigma is a huge thing. Like, he didn't want anyone to know, and that's so sad. So he isolated himself during his recovery, and we want to stop that stigma. Like, we're a normal family. If it can happen to us, it can happen to you.
We need to talk about this. We need to get out and get help because, like, substance use disorder is a disease, just like heart disease and diabetes. Early detection and early intervention make for better outcomes.
We need to realize that this is an epidemic and it has to be attacked properly.
It's like our whole community is affected in some way, from the top down to the poorest. The more we talk about it, and the more things like the Opioid Project, Sun Will Rise, you know, the more we do, the more we can help the general community. We say to the world, you know, like, substance use is out there. What can we do to prevent it? What can we do to support the people that are still in active addiction in their families? What we can do to celebrate the people in recovery and embrace the people who've lost someone. Our intention has been to support each other in our grief and to share the lives of those we have lost. Until we meet again, may you carry this experience with you as a reminder that you are not alone and the sun will rise.
Okay. Very well done. Thank you, Robin, for all you do and all you do to support families. And if you can just reiterate the fact that, how many chapters do you have now out there?
We have 9 grief support groups, not meeting in person right now, but we have 5 Zoom meetings going on instead.
Yep. So it's incredible. Thank you so much for sharing that. And I look forward to working with you on Friday to talk a little bit more with Val about that. So does anyone have, and Olivia is just incredible. What an incredible daughter you have. Does anyone have anything they want to say or add about the speaker series or about the video?
Just quickly, can I say something really quick?
Sure.
I think that's when Robin did the first Beanstalk and the whole thing with the grief and everything, I think that's when Braintree finally opened their eyes on stigma. And she was the one that did it. I really, truly believe that. And it came out great, Robin. I mean, you did a great job. I shared it on Facebook already, so, which I think you knew.
Mary Ann, thank you so much for saying that, because Robin has done a lot.
She made us all wake up. She listened. People listened.
Yep. So thank you. I'm gonna just keep moving on, guys. I don't know if Kim is back with us yet, but if she's not, I'll have her send out some information. I think
Lynn,
it's
I'm here
fascinating.
if you want me to.
Oh, you are?
I am so sorry. My computer went in automatic update mode with no warning. So I know it's getting really late, so I don't know what you want me to focus on, but basically what I was saying is people are really struggling out there, and the supports that are usually there for people are not. And, you know, just not having the technology. I know NA, AA is all online, but people don't have that technology. So what we've done is really shifted some of our focus and working with people to try and give them any supports they can. So the people who are out on the streets, we're bringing tents and sleeping bags and getting them food, and for people that need phones to continue with their treatment. We do have money from BSAS to anyone that's a client of ours that we're working with can get a cell phone, and we're paying the monthly minutes on their phones to connect with medical care. So that's been really helpful. We've just sort of been trying to, you know, support people in the best way we can, you know, and then overdoses, people aren't calling 911. They're managing it themselves, unfortunately, and they don't want to go to emergency rooms. They don't want to interact with the police because it just could put their whatever shelter they may have. And I'm mostly talking with a lot of the outreach we do is people who are unhoused right now because it is increasing because of the depopulation of the shelters and the release of jail, which I think I already spoke about, and not getting people into treatment. We also have really seen a change in the drug supply. We're seeing people as supply for food and everything else is disruptive for everyone. The drug supply is also disruptive. So in the very beginning, people are having a hard time getting in touch with their usual sources, which, as many of you know, is a high risk for overdose if you're not using from your usual sources. And people are also cutting the drugs with different things now that they can get. So it is more risky. We were lucky enough, and it was very timely, and part of our work with DPH, they partnered us up with this research project out of Brandeis. Dr. Tracy Green is looking at the drug supply and how it changes, and testing, so drug testing. So Chelsea, Quincy, and Western Massachusetts program was selected. It is out of the syringe program where we're having clients give us their drug trash. So baggies of drugs were in, cookers that they cooked it with, where they can take very limited amount and test it. So we bring it back to our office, and the drug testers come in with this very fancy machinery and give us a readout of exactly what it is. So we take information on what they thought it was. You know, I thought I was buying crystal meth, and it made me feel like this, it was different. So we kind of report on all that, and then they test it, and then we give the information back to that person to say, hey, it was crystal meth, but there was a high percentage of fentanyl in it, or it was cut with this. And so we're seeing very interesting results from that. People think they're buying dope and they're not, and it's really, it's been pretty interesting to see what's in the drugs that we're getting. So that's been a very interesting project. We're hoping that people will be safer about drug use. And of course, we work with them in a harm reduction way. So we will work with them to try and get into treatment if they want to stop, but if not, the safety of the person. So we're kind of trying to, our outreach crews are out 2 groups every day, twice a day, to high risk areas in all of South Shore. We focus mostly on Braintree, Weymouth, and Quincy, but we have done a little bit in Hull. So that's what we're seeing kind of in the streets, and more referrals. People are asking us for referrals for medication assisted treatment. And it's been nice. A lot of the barriers have been taken down to access medication assisted treatment. You know, once if someone gets on Suboxone, you know, we don't want barriers. We want them to be safe. It has naloxone in it. It's harder to overdose when you're on Suboxone, so it saves lives. BMC has been really great at spearheading sort of no tox screens, not bringing people in, doing some telemedicine phone work on the mat to, and we've seen a huge increase in our numbers of referrals. It'll be interesting to see what happens after COVID, if all these requirements, they're actually allowing refills on medication assisted treatment, which they used to never do. So a lot of the rules and regulations have changed. Did I miss anything, Lynn?
No, Kim, that was great. I just wanted people to get a sense of what, you know, what people, you know, what the outreach people that are out there every day, what they're doing for people, what they're finding. And thank you for all you do. And your people are amazing. People that you work with, very dedicated, and thank you for all that you do. And thank you for sharing that information. I just think it's good information for the recovery community, for people who are, you know, struggling, and for other, you know, I think it's good to know, especially that there are different things in the drugs. And so anyways, I'm going to be running. I'm going to need to get off soon, and I know that you're all probably wanting to get off soon. So if you have any questions for Kim, does anyone have a question for Kim right now, or is that something that you can email them to me and I can get them to Kim and he can answer them? Would that be okay? Do people feel okay about that?
Yeah.
Yeah. That's
okay. All right. Kim, thank you so much. I really appreciate it. And I want you to know, feel free to go if you need to. I know you started work at 7 a.m. this morning, and God bless.
Okay.
All right. Thank you. Anybody have any announcements, anything they want to announce or share before we end?
Lynn, just real quick, MAPC is hosting a webinar next week, Community-Wide Health After COVID-19. I can email you the details. It's free, using a trauma-informed approach to heal our communities, and you can pass that off to the group, anybody who's interested. I'm going to try to attend if I can get an hour out of my regular day. So
awesome, Meredith. Thank you. So Meredith is going to send that information to us. It's capital M, capital A, capital P, capital C, Diana. MAPC community-wide webinar after COVID-19. Thank you for sharing that, Meredith. Anybody else have anything they want to share or talk about?
If I may, Lynn, it's Christine.
Yep.
Very quickly, I just want to thank Meredith for highlighting the partnership in her last.
Oh, that's right. Oh, dear. I meant to put that in. Thank you.
Yeah, so Meredith, who is awesome, highlighted the partnership in her last monthly councilwoman's update to, I'm not sure, is it townwide or just her constituents? But in any case, it was lovely, and she's a real ally to this group. And so everyone should consider her a real friend, and even in the very short time that she's been with us. Thank you, Meredith.
Yes, thank you. And I will send that out. I think I sent it out to the folks that were involved in the strategic planning process, but I will send Meredith's newsletter to everyone. It was excellent. She highlighted Christine, and it was really nice, Meredith. Thank you. And thank you, Christine.
Yeah.
I meant to put that in here. We had so much on the agenda tonight, but thank you. Anybody else have anything they want to share or talk about? All right. So the next meeting will be June 17th. That'll be the speaker Val. And I'm hoping that we can maybe get like a half an hour just together real quick on another day that we can talk about a few other things like the calendar for the coming year. Diana, I'm just going to ask you, instead of going over the action steps, if you can just email those to me and I will get those out to people as quickly as possible. We didn't make a motion to accept the minutes, but I would have to do that via roll call. I don't know if we have, I sent the minutes out to everyone. Does anybody want to entertain a motion to accept the minutes from the April meeting?
So moved.
And that's Meredith?
Yep.
Is there a second?
Second.
Second, is that Derek?
That's Freddie.
Freddie?
Freddie, yeah.
And I think it has to be a steering committee member, sorry.
Never mind.
That's okay. Hopefully he's still here.
I can do it. Second.
Second by Derek, okay.
Yeah,
So I
got
have a roll call instead of, okay, so Derek, your vote?
He seconded.
Yeah, but he can vote. Now we're taking the vote. Roll call vote. Derek, accept the minutes.
What do I gotta say?
Yes.
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 Yes, Diana?
Yes, I do.
All right, Steve Larry.
Yes.
Yes, Andrew Marin.
Yes.
Is Mark Dubois on? No. And Christine Fosco.
Yes.
Awesome. And I'm gonna skip the plus Delta and everything. My family is getting together tonight because my daughter's birthday. Thank you all so much for being here. I hope you learn a little more about what's going on out there. And if you have any questions or comments, please send them my way. I'm gonna make a motion to adjourn, and I'm gonna go through the list again. Derek? Just
What do
say
I say
yes.
again? Yeah. I'm from Rhode Island. We don't have these things.
I know.
So funny.
A motion to adjourn. So Diana, will you make that motion?
I make a motion to adjourn.
Okay, Andrew, you second?
For the love of
Okay,
God.
second by Andrew. So Derek, you
Yeah.
want to hang up, right, Derek?
Yeah.
Okay, Diana,
Yes.
Steve,
Yes.
Andrew, and Christine. All
Good
right,
night,
thank you so
everyone.
much. I realized we did it wrong the last time and I wanted to do it the right way. So thank you so much, everyone. It's so good to see everybody. And
Bye, Lynn.
we'll see you next. I'll see you soon.
Thank you, Lynn. Bye, everybody. Take care.
Thanks, Lynn.
Bye.
Bye, guys.
Bye.
Bye.